ma'am. So we will like to ask your insight
Yes.
on we have a Monica who is our speaker, and she
Yes.
did asked even I tried to just give my insight, but
Yes. Yes.
since you're the expertise and I was trying to engage them, so how
Huh.
robotic system works, I like to
Yes.
welcome you here in this platform.
You?
Thank you very much for accepting the invite, and we have already introduced you to the audiences, and we would like to understand this, ma'am, how robotic system actually works in a
Yes.
very simple
Yes.
term. Yes, over to
Oh,
you.
yeah. People imagine that robotic surgery is, they imagine all the movies where, like a Spider-Man, the villain has all the arms and all. They imagine the robotic surgery being done like that. So,
Yes,
okay, their imagination is bit correct, but there's a small difference. So it's something like a laparoscopic surgery is we make the patient lie down on the table and put
yeah,
in the laparoscopy instruments, and the surgeon stands by the side of the patient and does surgery. This
yes,
robotic, there's some special robotic arms. The patient side cart is a special thing. It has
yes,
got
yes,
4 arms. So those arms will have multiple wrists. Wrist is like a basic hand. I think in the figure you're able to show. The sister is
yes,
clearly showing it. So,
yes,
and we attach that patient side cart to the patient.
yes,
But that cart moves only when the surgeon sitting at the console moves their fingers. So we sit at the console, put
yeah,
our head into the console. So there we can see a 3D image.
yes,
So the image which we see inside is different from what we see on the monitor outside. So
yes,
that 3D image comes only when the head is inside. So a lot of safety features will be there. That robot doesn't move, the arms doesn't move until the surgeon gives a command. So
yes,
the legs will press for the energy controls, the
yeah,
cautery and all the things. And hands we move for the robotic arms to be moved. So
yes.
that's how the robotic surgery
Yeah.
happens.
So here
Yes,
we
sir.
you mean to say that the total controlling and guidance has been given by you to the
Yes.
nurse here, yes, and the surgeries
Yes.
are being performed because you're operating here, right here.
Yes, yes. So we
Yes,
sit at the console. So now
yes,
the consoles are placed not just by the side of the patient. So trans cities. So from one city to the other city, the surgeons
to
are
the other,
doing.
yes,
From one continent to other continent, the
yes,
surgeons are able to do surgeries by this robotic technology.
yes. So
Yes,
I
Shanti.
think Monica, yes,
Yeah, thank you. Thank you for your information, madam. It's valuable for us. Thank you.
yes.
Yes,
So
Mamta.
I think,
Thank you.
yes, a few of the myths which we are able to understand from ma'am
Ah.
today. Yes. Yeah, Penam, as you work in, I think, have you been exposed to any of the robotic surgery so far?
Yes, ma'am. I have seen, ma'am.
Yes. So what is your, query you would like to ask our expert?
Yes, ma'am. I would like to ask, ma'am, that every control and is done by surgeon.
Yes, definitely yes.
Every
So until every control, even the single, what should I say, small millimeter cut or a thread tied or anything, everything goes with the surgeon only. So
Okay.
surgeon who is sitting at the console, they have to command the robot. Then only it happens. The
so
robot
the robot.
doesn't do anything on its own.
Okay, ma'am.
So, ma'am, here I would like to ask my own doubt.
Ah,
Throughout the procedure, let's say if at
yes,
all the hysterectomy, robotic
yes.
hysterectomy has been performed and it is
Ah,
for the half an hour duration, throughout the procedure, you will
ah.
not be able to lift your head.
Yeah,
Will
we
you be
will.
able? We will.
Yes,
You will.
we will lift our head, we'll move out. Then the robot freezes. It doesn't do any work.
Yes.
So we do a step, we just go back, analyze again, and then again put our head back inside. We don't stay there continuously.
Okay.
Yes, that's I think very interesting thing. Yes.
Ah,
So we do have our speaker who is from Nigeria. I think because of some technical glitch, she's not able
okay.
to, log in. Yes.
Huh?
But yes, since this is a robotic surgery, and we also like to understand what is the role of the scrub nurses when they assist you during this procedure, ma'am? Like what they are supposed to do. Like
Yes.
we keep hearing that, do we really require the nurses by the bedside or
Oh,
because
yes.
it is performed by robotic arms? So what is your
They,
insight on the same, ma'am?
they are a very, very important part of the team. See,
Yes,
robotics needs a lot of sterility procedures. So that sterility and each of them are disposable. So each arm acts for only these many number of times. So the scrub nurse has to keep a count of the sterility. So there are separate, what should I say, covers for the arms, and
Yes.
so we put in a
Sleeves.
robotic, yes, once an instrument, the cautery. So they have to be covered properly. Otherwise, there's every chance that the cautery, there might be a break in the circuit and a harm might happen. So that taking care of that continuity of that electrocautery, the circuit of the cautery, the sterility, and all these things are very important. These are all the duties of the scrub nurse.
Yes. And guide taking the instructions, loading the instruments and
Yes, yes,
positioning robotic
yes,
arms, taking care of
yes,
cables, etc.
yes.
Yes, yes.
So once
Very
we put
interesting.
Shanti. So once we put in a bipolar grasper, we do surgery with bipolar grasper. Once
Yes.
surgery is over, we should suture. Then that grasper has to be removed and a needle driver has to be routed inside. So these different steps need different activities by the scrub nurse.
Oh, and these are called bipolar grasper, etc.
Yes,
Yes.
yes,
Yes. So going forward, the discussion seems to be very interesting. And yes, yeah,
huh,
Monica,
yes,
Monica had a doubt on this slide and she
Yes,
would like to
ma'am.
ask
huh,
you for your insight. Yes, Monica.
Ma'am,
yes.
so far we learned a lot of things about this topic from you, ma'am. I'm very thankful. And can you please give your insight regarding how you will communicate with the OT scrub nurse who is there along with you during the surgery intraoperatively?
Yeah, so even I used to have a doubt before starting the surgery. So what happens is once we put our head into the console, there's a mic. So that
Uh,
mic, when we talk in the console, sit and keep our head inside. So that
Yes.
comes out, and throughout the OT, everybody can listen. In the room, whoever are there can listen to that voice. And
okay.
Oh,
if you
is
speak from outside, we get to know through the console we hear in our ears. So there's a communication between the surgeon and the scrub nurse through the console. It's like a
Oh,
mic. We whatever small
it's like
things
a
we whisper
yeah.
yeah.
It has got a total audio features, which is I think AI integrated now, ma'am, I think.
Yes, yes, yes,
Yes,
Shanti.
yes.
That's the word. That is the word. So
So
even the
yeah, a
small whispers we do
lot
in
of
the
myth,
console.
yeah.
Huh,
Lot of myths are getting cleared one by one, yes. And going forward, yes, yeah, as you said, sterility and other,
hmm,
damage control so that our patient do not receive any kind of harm. So, what
yes,
specific precautions should a scrub nurse or circulatory or those who are present should be taking? Because these are very expensive,
yeah,
robotic arms and bipolar,
yes.
retractors and all. So, what is your, take learning messages to the OT nurses here? Yes.
So Shanti, yes, they are very costly, but very delicate instruments. Even a small damage, a small coating goes away. Then, so the cleaning is a big process. I think the robotic nurse gets trained first for the cleaning of those instruments. They take so much of time to clean them after surgery, send them for sterility. The sterility is definitely different. You can't mix them with the routine things, and you
Routine,
have to
yeah,
send, yeah,
yes.
other OT instruments, send them separately in for sterilization. And then once they have come back, that circuit, I told you that energy circuit has to
Yes.
be maintained. The small covers, the breakage of those covers, they have to be checked regularly. So the safety of the patient, the sterility is what has to be taken care of.
So,
Yes.
yeah, a whole lot of pre-exposure training is given to the entire nursing staff so that the handling is done in a proper way. Yes,
Huh.
yes. So going forward again, yes, Pinam, would you like to have this insight from
Hmm.
your you wanted to ask a few queries from ma'am? Yes, Pinam.
Yes, ma'am. I like to ask you about what type of surgeries should be done through robotic.
Like very very minimal knowledges everybody has, ma'am, like whether it
Huh.
is like
Huh.
lab and robotic and whether, so yeah, we would like to understand what are the few indications which can be done with robotics and very great outcomes also we see. We were just looking at your blog and health talks and
Yeah.
lot of patient testimonials. So
Yes.
yes, your insight.
Yes, Shanti and Peenam. So, see, robotics, we can do multiple. In gynecology, we treat all conditions related to uterus and ovaries. So
Yes.
any condition, any things on the uterus, be it hysterectomy, be it myomectomy. Similarly, the tubes, fallopian tubes, any ectopic pregnancies, the ovaries, any ovarian cysts, dermoid cysts, endometriosis, all that we can do. Now we are using it for endometrial cancers. So the small endometrial cancer is a bit benign. What should I say? Not
Benign.
so,
Yes.
not so cancerous as the cervical and ovarian cancers. So this can be treated totally by surgery. So in robotic, we have something called as firefly technology. So once we inject a dye, we can see to which lymph node it goes by the robo. So we have that technology in the robo where we can check that lymph node and get that out. So the cancer surgery becomes very easy with robo. So apart from all the hysterectomies, myomectomies, ovarian cysts, we can also do a cancer surgery in a much better outcome than a open surgery.
So that is how I think going forward,
Huh.
we were hearing something called precision, targeted.
Huh.
That's how I think. And yes, what like benefits also. Of course, it has got multiple benefits. Like, and yes,
Huh.
we would like to also understand like
Huh.
enhanced precision, reduced trauma, improved visualization. And
Huh.
this is how you said magnification is much flexible and clear.
Yes, yes, Shanti. So
And
definitely the incisions are very small. Not so we do a 1 centimeter incision for laparoscopy. These are just 8 millimeters incisions. So 8 millimeters. And the robo arms, they don't pull the tissues. So in laparoscopy, what happens? Surgeon, they try to pull the tissues. So based on where they are standing, their height, things, and tremor of the surgeons. There's a lot of
yes,
traction on the tissues by laparoscopy. So that
yes,
pulling and pushing is not there with the robo arms. There's a lot of stable surgery which goes on, lot of precision. So we are cutting it, that millimeter cut goes. So that gives post-op very happy with the patient doesn't have pain.
yes,
Very quick recovery is what happens with the robotic surgery. And of course, a lot of happiness to surgeon. They're happily sitting and doing.
yes.
So
And
the
lot of,
ergonomic,
yes, yeah.
both for the
And when you
patient
see
and
your
the
patient
surgeon.
happy, you feel happy as well. Yes.
Yes,
Yeah.
yes, Shanti.
And I was also, told that it just, 360-degree, if you talk
Huh.
about the dexterity, right? It
Yes.
rotates, even the human wrist cannot be rotating that much. Like,
Huh.
yes.
Huh. So yes, definitely.
Yes, and yes, we have come to the end of the discussion because we thought we'll keep our session very crisp and very short so that, a few fundamentals only can be just, given in terms of awareness to the audience. Yes, we would like to hear what could be the learning points you would like to tell to the audience. Yes, over to you, ma'am.
So Shanti, the robotic surgery is definitely a better learning curve, but it is not the, what should I say, from a laparoscopy and from an open surgeries. So
Yes.
we have to learn these things. It's not that just like that you can go into a robotic OT and start
No.
doing things.
Yes.
Do a proper training. Get the trained under the whoever the people that are training for you. Get trained under them. Don't let egos and all come into it. And who are they? Why do we need training and all?
Yes,
Proper
yes,
training
yes.
is needed. Proper knowledge. So this works in bit different technology than what we usually do. So
Yes,
understand the technology, yeah, and be safe. So
yes,
if a hazard happens with robo, it's going to be a very bad hazard. So patient can just, what should I say, skid back on the table if
yes,
they are not properly fixed. And the robo
yes,
doesn't leave because the patient is skidding. It can hold the tissues and it can be very bad even to imagine. So a lot
yes,
of things are there. Learn each step, each principle very properly, how it works and where are the clutch buttons, where are the port buttons and all, and learn them properly. And then
yes.
I think then we'll have very good outcomes.
Yes, yes. So multiple observation and shadowing should
Yes,
happen when,
yes,
and after that few procedures to be done with the under supervision and guidance,
yes.
co-guidance, and then they can individually perform. Yes, as you said rightly, yes. So we have come to the end of the discussion. Speakers, do you all have to, wish to ask anything from madam, you can ask, yes.
Yeah,
Or otherwise,
thank you for
yeah,
your clarifying all our doubts, ma'am. It's very
yes.
useful
Thank
for
you.
us.
Thank
And
you, Monica.
yes, I would like to request all the viewers
Thank
that
you,
please
doctor.
do
This is a
Please
great
do
talk.
refer our website for a lot of health learning. Like yes, I see Dr. Shada's website. A lot of great patient testimonial and lot of reproductive female reproductive abnormalities are corrected. Just click onto the website and just learn by just listening to the health talks and a few blogs which has been published. Yes. Thank you, speakers. Thank you, Monica. Thank you, Penam. And thank you, Laval. Laval, we lost you, but yes, we are going to end the session. And thank you, ma'am. Thank you so much for your time.
Thank you, ma'am, for this wonderful
Thank
opportunity.
you. Yeah, yeah. Thank you. Thank you all.
Thank you, ma'am. Thank you.